for some years I lived in an assisted living facility and nursing care for our older friars. And so I experienced a lot of debilitating illness among them. And it kept me thinking about, how would I want to die? And one day we had a discussion with them and we asked them, now these were all old priests between 85 and 95 years old. Most of them had, multiple chronic illnesses. We said, well, how do you want to die? And I was surprised at how eager they were to talk about that. And to a person, none of them wanted to go to the emergency room again. None of them wanted to be in ICU. They wanted to die at home. They were very clear about that. They simply were ready for this next step in their lives. And I often thought, I hope that I can be as open to that when I get to be their age as they were, to know that I've done the best I can do and to be able to say to the Lord, okay, it's time.
At the end of the sermon, I said to the kids, children, I'm going to tell you what I want now. And in front of the congregation of 2,500 people, I gave my kids my instructions. And I said to them, you've always known what I love to do in the world. You know that I love to teach, I love to tell stories, I love to be part of the lives of the people who surround me. So long as I can do that, give me every medicine there is. But the moment the doctor tells you that I can't do that anymore, let me go. And that's my cutoff. If I can continue to function and give of myself to the people I care for and share their lives, that's what I like to do. Then I'll take whatever medicine you got. And I've been through some pretty awful medicine, and I'll take more if I have to. But the moment the doctor says, you're going to lose the capacity to relate to the people around you, you're going to become a shell of a person who's isolated, you're going to be stuck in this bed and not be able to share of yourself, I don't want to be in a bed. That's not what I want. And I certainly don't want to be in a bed in an ICU unit. Not that I have anything against ICU units, but it's not my idea of how life ought to come to an end. So I'm prepared for that.
If I were terminally ill and I felt that the chance of a significant recovery or improvement of my symptoms was impossible with aggressive management such as hospitalization or CPR, I would refuse it. I would want comfort care. I wouldn't want to be in pain. I would want, if I were short of breath, to be treated for that. Any other somatic symptoms that I had, I would like to be treated. I would want to be surrounded by loved ones, and I'd want to be in my home when I was treated, not in a hospital setting.
Doctors tend to use less medical care at the end of life. Less often in the hospital, less often in intensive care, pursuing fewer of the sort of long shot treatments. But when the angels come calling, don't stand in their way. I'm perfectly happy to have whatever days I get, but if I don't get as many as I might, it's okay. It's been a good life, and I'm willing to wrap it up.
If I am diagnosed with illness that I know was going to take my life, that's the way my life is going to end. I don't want life-saving, I don't want CPR, I don't want tube feedings, I don't want anything that is offered to me where the way I make meaning of it, that I didn't come into this world with it attached to me. I don't want to be leaving this world with it attached to me, okay? In other words, I don't need tube feeding, I don't need intubated. I just don't look at it that way. Let it go.
I definitely don't want to suffer physical pain or shortness of breath or nausea. That's my highest priority. I don't want to be terrified of suffering. Beyond that, I really leave it to the people who love me to do what would in some ways be best for them. Okay? So I have said to them, if I'm in a state where I am not going to recover, to be able to recognize you and interact with you. Personally, my only goal is comfort. And if I die sooner, that's fine with me. However, if for one of you, it would be important that I hang around, say, to your son's bar mitzvah or to an anniversary date, or that's okay. I just don't want to suffer. So
my hope when I have a serious illness, or indeed when I'm dying, is that I will be cared for by a palliative care team, and at some point that will transition to hospice care. Why do I hope for that? A couple of reasons. The data suggests that I will feel much more comfortable if I'm cared for initially by palliative care, and then when I'm dying by hospice. But more importantly to me, the data suggests that my family will have much better outcomes. We've seen that compared to people who die in hospital, families of people who die in hospice have much less prolonged grief disorder, much less post-traumatic stress disorder, or PTSD as it's commonly called, have a better quality of life, and recover from the death of their loved one better than those people who don't receive hospice and palliative care. That's what I would hope for my family.
If I was told that I had hours to days to weeks to live, I would not want resuscitation. I would want a natural death, knowing if I had a cancer that was going to ultimately take my life, then I would prefer a natural death.
In my own personal feelings, you know, I as an ICU nurse and now as a hospice caregiver, I've had the opportunity to provide, you know, help with mechanical ventilation and artificial tube feeding, that kind of a thing, even IV nutrition. Many of these things are you know, they are very artificial in nature, and they're all things that, you know, our bodies are just not really meant to receive. You know, especially for the long term. And so anytime technology is really kind of taking over the role of our heart, our lungs, you know, our nutritional intake, those are things that, at least for my purposes and my opinion, I would not want those things to be long-term solutions for me.
I have so many physicians and nurses who have said to me, Helen, if I'm ever in that bed and this is what's wrong with me, please throw yourself between me and the caregiver, because I don't want this done to me. Many of them want to go home. They don't ever want to get to the point where they're so sick that they have to go in the ICU and potentially have these things done. I do have a living will and an advance directive, and my wish is that if there's an acute illness that I need to be supported through, then I will accept advanced measures like a breathing tube, a ventilator, but that's not something I want long term, because I chose the type of advanced directive where I can write a little more. It's not check boxes, yes and no, and quality of life to me is being able to be with my family, being able to talk to them, enjoy life with them, go places to see them. My kids are in their 20s. They're gonna be having kids and families, and I want to be able to go and enjoy that. And if I can't, then that's not quality of life for me.
Certainly, we know there have been some interesting studies that have indicated that physicians, when they're faced with their own mortality, are very specific about making some choices to forego many of the things that we subject sometimes our patients to in the hospital. So it's not uncommon for doctors to say, not me, I don't want to be in the ICU. If I become, if I have some terminal event, don't send me to that ER, don't intubate me, don't start CPR, allow things to happen in whatever way they're meant to be. If something unforeseen happened to me and my heart stopped, I would not want to alter the course of what was supposed to happen at that event. Would I want a breathing tube put down my throat to breathe? So because I wasn't going to get CPR, I didn't want them to do that either. It just didn't make any sense to do one without the other. Would I want a feeding tube if I was in a situation where I could no longer take nourishment by mouth? Again, I said I would not want a feeding tube. I know what the pros and cons of a feeding tube would be. And if I'm in that situation where that's the only alternative, I would want, nature to take its natural course.
If I had a terminal illness and was at a stage of life where I was older, my children were grown, I probably would want my care to focus on quality rather than quantity of life. I think I'd always want my care to focus on quality rather than quantity. It's that ratio, it's that trade-off that I think changes over time.
Well, when I have a disease that I think is rolling along in a progression that I cannot stave off and whose endpoint I inevitably sense, I would talk to my doctor, I would talk to my family, and I would tell them, if they don't listen to me, I'm going to come back and haunt them, number one. Number two, I will be very shortly tattooing on my chest, no CPR, and on my backside it will say, turn me over. So regardless of how I am found, you are not going to do what you think you want to do.